Hello, my name is Talar, and today we're going to talk about high blood pressure. Our objectives for today are to define blood pressure and high blood pressure, distinguish between systolic blood pressure and diastolic blood pressure, examine the risks associated with high blood pressure, identify individuals at risk, and discuss steps to prevent high blood pressure. Good morning, Mr. Chekian. My name is Talar, and I'm going to go ahead and take your blood pressure.
Great. What is blood pressure?
Well, blood pressure is the pressure exerted on your arteries by your blood.
So, how's my blood pressure?
Well, it's very good. It's 120/76.
What does that mean?
Well, the first number is your systolic blood pressure. That's when your heart ventricles are going to contract and they're going to pump blood into the body. And the second number is your diastolic pressure, which is when your heart ventricles relax and they get filled with blood again.
What do you consider high blood pressure?
Well, according to the American Heart Association, 140/90 or greater is considered high blood pressure.
Why do we care about high blood pressure?
Well, because high blood pressure can be associated with many diseases. It can cause heart attacks, stroke, peripheral artery disease. It can cause fatty buildup in your arteries. It can cause erectile dysfunction, kidney damage.
What are the signs and symptoms I should be looking out for?
Well, unfortunately, there are no signs and symptoms for high blood pressure. That is why it is often called the silent killer. And that is why it is very important for you to get regular blood pressure checkups and keep a log of those numbers.
I see. Who's at risk for high blood pressure?
Well, anyone with a family history of high blood pressure, anyone who's obese, overweight, poor diet with lots of salt, anyone who drinks too much alcohol, and certain ethnic groups are at increased risk, like African Americans.
Wow. And what can I do to prevent high blood pressure?
Well, you want to eat a healthy diet, decrease your salt intake, maintain regular exercise, make sure you manage your stress levels, and don't smoke, and check your blood pressure on a regular basis.
Great. Thanks.
You're welcome. Let's review, shall we? What is blood pressure? Blood pressure is the pressure exerted on the artery walls by circulating blood. High blood pressure is 140/90 or greater. What do the numbers mean? Systolic pressure occurs when the ventricles contract to pump blood into the circulatory system. Diastolic pressure occurs when the ventricles relax and the heart refills with blood before the next contraction. What is considered high blood pressure? If your blood pressure is higher than 140/90. Why does high blood pressure matter? It can damage the heart and the arteries, including heart attack, heart disease, and fatty buildup in the arteries. It can cause a stroke. It can cause kidney damage. It can cause erectile dysfunction, and it can cause peripheral artery disease. What are the signs and symptoms of high blood pressure? No signs and symptoms. That is why it is often called the silent killer. Individuals at risk: anyone with family history of high blood pressure, advanced age, lack of physical activity, poor diet, especially high in salt, overweight and obese, drinking too much alcohol, as well as certain ethnic groups such as African Americans. What can I do to reduce my risk? Eat a healthy diet, less salt, regular physical activity, maintain a healthy weight, manage stress, don't smoke, and check your blood pressure regularly. Thank you for your participation.